everyone, this is Dr. Leonard with Central Ohio Spine and Joint, and we're back again with another video on our Focus Shockwave device. So one of the most common questions we get in the clinic is, does Shockwave actually work? So we wanted to talk a little bit today about that. I think it's important to first, again, talk about kind of the mechanism behind what Shockwave is actually intended for and what happens when we actually use the therapy. Okay, so first let's talk a little bit about what Shockwave therapy actually does. So Shockwave therapy, the device I have in my hand right here, actually sends acoustic shockwaves down into the tissue. I always explain it as, think of it as almost like a little mini jackhammer into the tissue. So it sends acoustic shockwaves into the tissue. It stimulates a couple different things. Number one is it actually will stimulate cellular regrowth. It enhances circulation in the area. And in total, what we're looking for is actually tissue regeneration. Again, think of it as a little mini jackhammer. It breaks up some of the tissue. Your body creates some inflammation, which actually helps the tissue then regrow, okay? So when we talk about efficacy of a tool like Shockwave, like any other therapy that's out there, whether it's conservative care, whether it's injections, stem cell, even surgery, the most important thing that we look at is patient selection, okay? So the clinical studies show that the effectiveness of Shockwave is up to about 85%. Really, really good statistic, but I also think it comes down to the correct patient selection. So one of the most important things we do within the Shockwave process is the diagnostic scan that we've talked about in previous videos. With the diagnostic scan, we're able to very accurately determine the site of treatment or the site of dysfunction. If you remember back from one of our previous videos, as we go through that diagnostic scan, healthy tissue, you really won't feel any of the acoustic shockwave into the tissue. As we start to get over more dysfunctional, torn, or inflamed tissue, you will actually feel the symptoms of it. One of the most vital pieces of Shockwave is that feedback that we get from the patients when we get over the dysfunctional tissue. So if we are accurately able to reproduce the patient's symptoms, I would say 85% success rate is extremely accurate. Again, it comes down to selecting the right patient for the therapy. If we go through the diagnostic scan and we feel that someone's not a good candidate for it, we've got a whole host of other services that we can offer that patient, so they may not be the right candidate for Shockwave therapy. All right, if you have any questions specific to Shockwave, the effectiveness of it, or about our diagnostic scan, we'd love the opportunity to answer it for you.